This is Dr. Sam, medical advisor and trainer for Dermaqual Paris. Today I'm going to talk about a new device that we have, Forza Laser. What is Forza Laser? Basically, it is a diode laser-based device comprising of dual wavelengths of 980 nanometers and 1470 nanometers. Both these wavelengths together combine to bring about fat melting, reduction in localized pockets of fat, as well as skin tightening. At the end of the procedure, it's up to the operator whether they want to extract the melted fat or let the body get rid of the fat on its own mechanisms. Some indications for Forza Laser include double chin, abdomen, fat on the thighs or arms, loose skin anywhere on the body, including the hands and the knees. After the procedure is done, patients should be advised to wear compression garment 24 hours a day for at least 3 to 7 days. After that, for as long as required, patient must wear the compression garment. Patient will experience some swelling, which is completely normal after the procedure, and it may subside over a period of 1 to 3 months. Patients should be advised that the complete result from the treatment will be seen after 3 months of treatment is completion. Since Forza Laser works on two mechanisms, mechanism number 1 being melting of the fat and number 2 being collagen stimulation, which tightens the skin, the full results of treatment takes about 3 months to manifest. Patient must be advised to be patient for this 3 months period, and after the 3 months are over, they will be able to experience the complete results of treatment. Begin the procedure by marking the patient. Make 3 entry points, one at both sides of the mandible and one underneath the chin in the midline. Sterilize the patient properly using a pyodine solution. Ensure all your supplies are present in the sterile table and every equipment is maintaining sterility. Ensure good patient sterility and introduce lidocaine injection at each of the entry points. Afterwards, introduce a big needle 18 gauge and at this point introduce 2% lidocaine in a clean solution formulation to infiltrate the whole area. Use all the 3 entry points to introduce lidocaine in a clean solution. Now prepare your cannula. Mount the cannula on the cannula holder. Screw it up tightly, so this ensures that the cannula is firmly in place, and now the fiber can be introduced from the back of the handle into the cannula. Insert the cannula into the tissue. Make sure the movement is smooth and patient is comfortable. Ensure back and forth movement of your cannula, all the while keeping an eye at the temperature of the patient. Ensure back and forth movements of the cannula are smooth and the patient is comfortable. Keep an eye on the temperature of the skin and ensure it does not exceed. In terms of movement of cannula, make sure that you are able to hear a popping sound from the interaction between the laser and the fat pockets. Complete enough number of passes to ensure that all the fat has adequately melted. For the double chin area, you can choose between 3000 to 5000 joules. Once enough energy has been delivered in the tissue, for double chin between 3000 to 5000 or 6000 joules, now we can perform suction of the melted fat. This can be done either using a suction machine or manual suction using a syringe in a vacuum. After suctioning of the fat, you can use the bare fiber and introduce the fiber again into the tissue, keeping it closer to the surface of skin and making sure that that brings about tightening of the tissues.